afternoon. This is Celia Lacayo with UCLA LA Social Science, the Associate Director of Community Engagement and Professor in Chicano Studies and African American Studies. Today we have a somewhat hot off the press public policy by Chris Zepeda-Millan, a professor in public policy and Chicano Studies, who's written the book Latino Mass Mobilization, Immigration, Racialization, and Activism. Hi, Chris. So good to have my dear colleague with us today. How are you today?
I'm doing well, thank you.
Well, let's get started. And can you tell us, kind of the overview of this public policy brief and starting with how has COVID-19 impacted incarcerated populations and immigrant detention centers?
I think it's important to remember that even before the COVID-19 pandemic occurred, jails, prisons, and detention facilities already had pretty bad conditions. In terms of detention centers in particular, for decades, government and NGO reports had found that their conditions to be pretty dire. For example, in addition to verbal, psychological, and physical abuses such as rapes and beatings by detention staff members and guards, many of these detention centers have been found to be unsanitary, have freezing cold temperatures, poor sleeping accommodations, such as having to sleep on hard concrete floors, no access to things like showers or soap, inadequate medical care, and to be dangerously overcrowded, sometimes operating at 3 to 4 times their capacity, with detainees packed into standing room only spaces. In fact, the Department of Homeland Security's own Inspector General described the conditions of overcrowding as a quote-unquote ticking time bomb. So in terms of what this all has to do with your question about how COVID-19 has impacted incarcerated populations, I think the CDC has been recommending social distancing of at least 6 feet as one of the primary ways for us to fight this deadly disease. Now, obviously, this health and safety recommendation is impossible to practice in jails, prisons, and detention centers, given the overcrowded conditions that I just mentioned. So not surprisingly, in some of these facilities, we're seeing some pretty bad outbreaks of a disease that we still really don't know the long-term effects of. So, for example, we know that our doctors are finding that even in asymptomatic patients that are positive with the disease, they're getting blood clots, right? We don't know what the long-term effects of things like that are going to be yet. According to the CDC, of the jurisdictions that are reporting data to them, 86% have reported at least one COVID-19 case among incarcerated or detained populations or staff members, right? And the data on the CDC website is a bit outdated, unfortunately. This isn't really a priority for them, unfortunately. But as of last month, as of late April, they were reporting that about 5,000 incarcerated or detained persons and close to 3,000 staff members had been diagnosed with coronavirus. And of those, nearly 600 had to be hospitalized and over 100 had died. In terms of migrants in detention, I think the number is probably an undercount, given that the last report that I saw said that only about 1% of detainees had been tested. But of those 1% that had been tested, 60% tested positive for the coronavirus, which I think is pretty terrifying for an institution with such a poor track record of medical care and overcrowding.
Thank you. So it's very clear that these are very dire situations, and yet the administration is not really responding. What is amazing about your data is that it reveals public opinion about these matters. Can you share that data and why it's so important?
The data we have is from a survey that was taken before the COVID-19 pandemic. And even before then, for years, there had been several government reports and NGO reports talking about the lack of adequate medical care in detention centers and detention facilities. So we asked the public, specifically, we were interested in asking the public about their opinions of what should be done with children that are detained by immigration authorities. And we asked that in a survey, and the possible answers we provided survey respondents were should children, so the exact question that we asked them was, what should be done when migrant children are detained by immigration authorities? And possible answers were to place the children in an immigration detention facility, or to release them to a family member or sponsor. Or the third option was to deport the children. And our results showed that the public overwhelmingly rejected detaining children as the best policy option. In fact, 82% of those surveyed said that they supported releasing immigrant children to family members or sponsors. Only 11% supported deporting migrant kids, and only 6% backed keeping migrant children in detention facilities, right? And this is without us even knowing if they knew how bad detention centers have been historically. These findings, partisanship did play a role in our findings, but almost all Democrats, 97% of them, and a very solid majority of Republicans, 57% of them, chose releasing child detainees as their preferred policy option. In fact, only less than a third, only about 27% of Republicans supported deporting the migrant children, and only 16% of Republicans chose detention. 16% of Republicans chose detention as their preferred policy option. So again, I think overwhelmingly in terms of keeping children in detention, the country really supports releasing migrant children from immigration detention facilities.
Thank you. This is the data that you have is really powerful in the sense that, as you mentioned, overwhelmingly people who were sampled don't want the children to be deported, which is mostly what's happening. They want them to be released. Can you tell us why even in the Republican Party, when you said 57% want the children to be released, while we have an administration that isn't abiding by that public opinion?
I did want to add that although our survey was taken before the pandemic occurred, I think it's important to note that the public obviously knows now that the conditions in detention have obviously worsened with the pandemic, right? So I personally would think that the public might be even more strongly in favor of releasing children from detention now that they know that there's a pandemic going on, right? And that it's spreading in amongst incarcerated populations. In terms of why the current administration is choosing not to release kids from detention, I honestly could only think of two possible constituencies that benefit from keeping kids in detention. One being the president's rabid nativist base, right? We know that anti-immigrant sentiments was one of the primary or driving forces behind Trump voters, right? And we know that almost any anti-Latino immigrant thing that President Trump does, his base really supports, right? So given that it's an election year, this may be one of the reasons why he's trying to appease them, right? By not releasing these children. The only other constituency that I could think of that benefits from keeping kids in detention and on all migrants in general is the private prison and detention industries that are profiting from keeping immigrants in detention, right? And if President Obama was the deporter in chief, I think President Trump is definitely the migrant incarcerator or detainer in chief, because he's breaking records in terms of the record levels of migrant detention and the number of people he's detaining or migrants he's detaining. So I think that there also may just be a lack of knowledge about the degree to which the public, including Republicans, support releasing migrant child detainees, right? This is definitely a bipartisan issue, right? Oftentimes, elected officials are worried about an electoral backlash in terms of the positions they take, and this is arguably, according to our data, a pretty safe issue for both Republicans and Democrats to come together with and support the releasing of migrant kids to family members or sponsors. So I think this is one of the important parts of our research, one of the reasons why it's important to do this type of research, because hopefully it provides a cover for both Republicans and Democrats to know that they're actually doing something that not only their constituencies but that all Americans pretty much support, which is releasing kids from these dangerous detention centers and in the middle of a pandemic.
So, Chris, your data shows very strong support from the public opinion for detainee children to be released. What are their opinions on support for child detainees to have medical care?
Sure. I mean, that's a really important question right now, given the pandemic and the fact that detention centers have a horrible record of providing pretty inadequate medical attention to detainees. There's been a series of deaths due to lack of medical care in detention centers. So because of that, survey respondents were asked to choose items from a list of different rights and accommodations that they believed children in detention should have. So this list that we provided them with included things such as medical care, personal hygiene products, adequate amounts of food and water, English courses, outdoor time for play and exercise, proper sleeping accommodations, room temperature, things like that. And our survey results demonstrated strong evidence that the public also strongly, in fact overwhelmingly, supports access to medical care and various other accommodations and rights for children detained by immigration authorities. And this support really transcends partisan differences. For example, over 90% of our survey respondents said that they supported ensuring detained children's access to 6 out of the 10 accommodations that we listed, and this is including medical care. All right, so and these findings hold even when one examines partisan differences, with Republicans and Democrats scoring at least 85% for provisions such as medical care, hygiene products, food and water, temperature control, accommodations, sleeping accommodations, and things like that. So the key finding here, though, in terms of the pandemic is, there was already over 90% support for adequate medical care for children in detention. And again, I'm sure that has probably only increased during this medical crisis, health crisis that the country is currently enduring.
So, Chris, your research really is also reflective of the cutting edge type of projects and research coming out of UCLA that are really relevant to public policy. And as you said, this lack of knowledge, and this is why we're here today, to get more folks to know that in fact this is a bipartisan issue, and folks are overwhelmingly wanting to release child detainees. This is really important, and we really appreciate your time today. So we want to say thank you, and we will have you back on for other events. Thank you so much, Chris.